So think about this for a second. Hospitals, they record so many brain surgeries, right?
Oh, absolutely. Countless hours of video.
Exactly. And mostly they just sit there. Maybe for the records, perhaps a quick review if something comes up.
Right, they're archived. But actually used for learning on a large scale, not so much.
It feels like a massive missed opportunity, like this huge library of surgical experience that we're not really tapping into systematically.
That's precisely the problem this new technology, computer vision, might help us solve.
Computer vision.
Uh,
Okay, break that down a bit. What does that mean in this context?
Basically, it's about teaching computers to see and interpret images and videos.
Like understand what's happening in the surgery video.
Exactly. To watch it and identify different things, structures, instruments, actions, kind of like a human would, but potentially much faster and over many, many videos.
Okay, so we've got these mountains of videos and computer vision that can potentially analyze them. Where do we even start? What can we realistically hope to learn?
Well, the first thing, and this is key, is deciding what we actually want to know. You need clear goals.
Makes sense. Like what sort of goals?
For instance, maybe we want the computer to identify and label different parts of the brain as they appear, or maybe break down a complex surgery into its distinct phases or steps.
Okay, like chapter markers for the operation.
Sort of, yeah. Or another goal could be tracking surgical instruments, how they're moved, when they're used, that kind of detail.
Wow. And could even help evaluate technique eventually.
Potentially, yes. Understanding different approaches and their nuances could be a long-term outcome.
That sounds incredibly powerful. But, it can't be as simple as just feeding the videos into a computer, right? How does it learn to see all that?
No, definitely not plug and play. You need the right tools. There are foundational software libraries that give the computer basic seeing abilities.
The building blocks.
Exactly. And then there are more sophisticated platforms, systems designed specifically for teaching computers complex patterns, especially in visual data like videos.
And you mentioned teaching. How does that work?
That involves using special programs where humans experts actually go through parts of the videos and label things.
Label. You mean pointing out this is the cerebellum, or here the surgeon is using forceps.
Precisely. You're essentially creating a detailed guide, an annotated data set for the computer to learn from. It's like showing it examples and telling it what they are.
Okay, so humans have to manually tag elements in the videos first. That sounds, pretty labor-intensive up front.
It is. It's a really crucial step, though. The quality and accuracy of that labeling directly impacts how well the computer learns.
Right. Garbage in, garbage out, basically.
Pretty much. Without good labeled data, the system just won't understand the context or the details correctly.
So let's say we've done that. We've labeled a bunch of videos. What's the next stage? How does the computer take that learning and apply it to new videos it hasn't seen before?
That's where different types of computer models come in. You can think of them as specialized computer brains.
Different brains for different tasks.
Kind of, yeah. For recognizing objects within a video frame, like spotting a specific anatomical landmark, we often use one type. For understanding the sequence of actions, like the flow of the surgery over time, another type is better suited.
And you mentioned outlining things.
Right. For segmenting, like precisely outlining a tumor or a blood vessel in medical images, there are specialized models designed just for that task. We train these models on the labeled videos we created.
And I assume we need to check if these models are actually getting it right.
Absolutely. We use specific metrics, ways to measure performance like accuracy, precision, recall, essentially checking how often the computer identifies things correctly compared to the ground truth labels. Validation is critical.
Okay, so we train, we test, we validate. Then what? What's the payoff? How does this change things for surgeons, for patients, using all those old videos?
The payoff is huge. Once these systems are reliable, we can unleash them on those vast archives of surgical recordings.
And they just analyze them automatically.
Yes. They can provide surgeons with incredibly detailed insights about anatomy in specific cases, about the flow of common procedures, maybe even highlighting subtle variations in technique across hundreds or thousands of operations.
Things a human just wouldn't have the time or maybe even the ability to spot by watching one video after another.
Exactly. It turns those passive recordings, that data just sitting there, into an active resource for learning, for quality improvement, for surgical planning even.
Can you give an example?
Sure. Imagine you're a surgeon prepping for a particularly tricky or rare procedure. What if you could instantly access an analysis of hundreds of similar past cases, highlighting common challenges, successful maneuvers, anatomical variations, all extracted automatically by computer vision?
Wow. So instead of just gathering digital dust, these videos become this dynamic, searchable, analyzable knowledge base.
That's the vision. It's about unlocking the latent value in data we already have. It's a powerful way to potentially accelerate learning and refine surgical practice.
It really is transformative. We're talking about turning a historical archive into a tool for future improvement.
Precisely. Using computer vision this way offers a remarkable opportunity to deepen our understanding, improve techniques, and ultimately work towards better patient outcomes.
It really makes you wonder, doesn't it? If we start analyzing thousands upon thousands of past neurosurgeries this way, what completely new things might we learn about the brain itself or about the absolute nuances of surgical skill? It feels like we're just scratching the surface of what's possible with data we've had all along.
Yeah,